queerness and sex characteristics. There's also a lot of softening of what happens to intersex people by using language like gender alignment. And in this session, we are not using language like saying this is gender alignment. We are explicitly and consciously calling this intersex genital mutilation, infant genital mutilation, because it is a mutilation. It is a form of torture against intersex people, and it is unnecessary, deferrable medical surgery on intersex people without their consent. So we choose to use the word mutilation instead of calling it something like alignment or medical surgery. And because a lot of times there's a shock factor around the name mutilation, but not shock around what is done to intersex people. And so thank you very much to my panelists. So the video showed quite a lot of what happens to intersex people in South Africa. And I want to ask Ronnie, for you in Zimbabwe, does this resonate? Is it a similar experience for intersex people in Zimbabwe, or is it a totally different issue?
Thank you very much, Tabi, and thank you for having me on this program. Yes, in Zimbabwe, these surgeries are still happening. And the unfortunate part, though, is that even the government of Zimbabwe, through the Ministry of Health and Childcare, they are still defending these types of surgeries and arguing and accusing intersex activists of trying to stop surgeries which are saving the lives of intersex children, even though we know as intersex people who have been affected by these surgeries, we are living the realities of the consequences of these surgeries. And even the government itself, it's not willing to engage with us, to listen to us. When it comes to these surgeries, they still defend these surgeries, and they are still happening. Right now, as I am speaking, we've had several cases whereby there is a major hospital in Bulawayo. I think those who have been following the news, they are quite aware that there is Mpilo Hospital, whereby some health professionals are actually arguing to say that these surgeries should be encouraged to continue on intersex bodies, especially on infants, so as to protect them. But as much as we know, these surgeries, they do have negative consequences, especially many years after the child has gone through those surgeries. So it is very unfortunate that the government itself is not willing to listen, but it still continues to impose those surgeries on intersex children, despite the fact that the children, they tend to suffer psychologically, even in terms of their physical health. There are many health challenges that they encounter as they grow up. And we, as the intersex community and activists, we are coming forward to sensitize society on the dangers of these surgeries, so that parents and even some medical practitioners may be aware that we are the living reality. We are living the realities of the effects of these surgeries. So yes, it is still happening here in Zimbabwe.
Thank you so much. Thank you, Ronnie. Thank you for that. Bana, Ronnie said something quite important. Says doctors are not willing to listen. And as ISA, as Intersex South Africa, would you say that's also a similar experience in South Africa, that this is still happening? Doctors are not willing to listen.
Thank you very much, Ntapiseng, and good evening, good morning to other people. Well, we all know that yes, within the regional context, that it has been a challenge where doctors are not willing to listen in terms of this, and that perpetuates a lot of barriers within laws, policies, and economy. Within South Africa for intersex children, violations are still happening where consent consent is not given to offer parents or even us to actually access our medical records in terms of all of this. So it's still a challenge within South Africa. One would be that intersex gender mutilation is still happening, and doctors are not willing to listen in terms of ensuring that there's consent before they actually exercise these particular surgeries within these hospitals that are around our country. And that leads to quite a number of issues that affect intersex people. I think the law itself, the policies that are there, uh, are things that actually, are barriers that makes intersex community to be vulnerable, where inadequate access to health care is also an issue. Affirming medical health care, it's something that I think we don't even conversate around. We've seen the video that actually just shown that it's a struggle for us to actually access even our information when you're out in your adolescent stage, where non-record medical records are accessible, and it's a challenge. So it is still an issue within South Africa as well. And my fellow colleague also mentioned the issue to say uh, there's no consent regarding you know parents having to decide whether, or actually waiting for the child to actually give and develop to enable them to have an informed decision. Parents are not given, adequate information regarding, conditions that children are experiencing. Yeah.
Thank you very much for that, Bana. It's quite difficult when you're an activist and you're fighting against an entire medical fraternity, understanding how society views the medical fraternity as this very trustworthy group of people that are always doing right, that can never do wrong, and that always know better than you. I understand what you're saying. And also the issue at the end of the day is that, of course, IGM, and it's something that's coming up in the chat today, is that IGM is about maintaining a sex binary. It's about ensuring that there are two need boxes of male and female, right? But at the end of the day, doctors will always dispute that. They're saying we're not maintaining a binary. What we're doing is for the health of the intersex individual. But Crystal, I don't know, to you, how do you get doctors to realize that this is a human rights violation? It is not for the health of the individual. It is actually, to maintain societal norms according to a socially constructed idea of what sex is. You're muted, Crystal.
Yeah. Hi, everyone. Thank you so much, Intabe. Yeah, I think this is such an important conversation that we are having. And it's true, IGM is a human rights violation. And, that's something that we have to state clearly, because IGM practices, firstly, it's about all the time, it's non-consensual, medical, unnecessary, irreversible cosmetic surgeries performed on children or on teenagers or adults. The thing is, the world is still trapped in binaries of male and female. And when the doctor sees a child that is born intersex, the first thing that they think about, how can we fix this child? How can we normalize this child? Because they want you to tick those little boxes, right? But no way do they ever think, okay, is this actually going to benefit the child? Or is it just because of the social constructs that are built of male and female? Most of the time, these surgeries are also very experimental. Every time when you speak to an intersex person, they'll tell you, well, I felt like a science project. I felt like they were researching my body to either write a paper or to give them clarity, when it's really not about the patient, but it becomes actually about the doctor in itself. And that is the real big problem that we are seeing in society, is that intersex healthcare is not really to the benefit of the intersex person, because sometimes there's actually no risk or anything wrong with the intersex person at all. It's just the fact that they are intersex and they do not fit the binary notions of male and female. And then you get doctors, it's like, but how can we fix this? How can we make them fit? It's this notion of people thinking that they can assign a gender for someone, where gender is something that you choose that for yourself. No one can choose that for you, right? But they try to put you in these boxes. And what, oftentimes the surgery that gets performed on intersex children, it's labeled as torture, because it doesn't just stop at that surgery. Because after the surgery has been performed on intersex people, they then have lifelong severe physical and psychological pain and suffering as well. Even dealing with impairment of sexual sensation, painful scarring, painful intercourse, and all the psychological things that comes with that, right? So now doctors are saying, well, if they always say it's a life to death when they're speaking to parents of intersex children. We need to perform the surgery because it's a life or death situation. But where's the research that this is a life or death situation? Like, where's the research? Where's the medical records? Where's the information? So what we are saying as intersex activists is that, intersex people do deserve that bodily autonomy. They are the ones that need to make decisions about their bodies, but yet you still get the medical fraternity forcing their decisions on intersex people. Thank you.
Thank you, Crystal. This reminds me of a couple of weeks ago, I think, as intersex activists in South Africa, we all were livid against a doctor who came live on social media and then repeated these sentiments live on radio and said, intersex conditions are life-threatening, and that's why we do what we do. And then we went back to her and we said, you cannot use language such as life-threatening. Some, very few intersex conditions can have, medical, a medical emergency. But that medical emergency does not mean that you now have to do cosmetic surgery on the person. Focusing on a medical emergency should not necessarily lead to more surgeries on the person. And then this doctor completely said, I don't want to have this conversation with you anymore. Do not text me, do not email me, do not call me about this anymore. And of course, they're a doctor that has tons of power at an academic hospital in South Africa. So they will continue doing what they did and not listen to what we're saying. So I think, colleagues, at the end of the day, we know what the challenges are. The video told us what the challenges are. You've told us what the challenges are. And I think what I'm more interested in is finding out, what are you doing to challenge IGM in South Africa and in Zimbabwe? Crystal, what is ISA and allies doing to challenge IGM at the moment?
Yeah, so basically, I think this has been coming on since 2017, when Intersex South Africa went out of its dormancy, obviously with the help of an organization called Iranti. So over the last few years, there's been different, campaigns and initiatives to ensure that we get visibility, so people are aware of the violations that intersex people face. And that we could put a stop to intersex genital mutilation. I think the first thing was to have a national engagement with our Department of Justice. Also, we invited different other various stakeholders, and we explained to them regarding intersex genital mutilation and how these surgeries that are non-consensual, sterilizing surgeries, are very harmful and traumatizing to intersex people. Initially, just to get the conversation going. Since then, Iranti and Intersex South Africa has been part of various engagements. Last year, November 2020, Intersex South Africa submitted an amendment to the Children's Bill of Rights where we've basically asked them to focus to ban genital mutilation in children. And we are also advocating that when they're speaking about female genital mutilation, which is something that gets spoken about all over, is to include intersex genital mutilation into that conversation as well, because there's already law and policies against female genital mutilation, and it would be so easy to amend, or reform those policies to include intersex people as well. Also, we've just recently had the SAEU conference, which brought together different government departments, such as our Department of Health, Department of Justice, Department of Home Affairs, that we can speak about the violations that intersex people faces under the medical fraternity. And this is also an opportunity for us as an organization to make sure that we are in the right conversations to get the policies changed for intersex people in South Africa, because it's so difficult when you get into these situations, is that, people always want to talk, and we've been talking for many years, but I think it's now the right time that we actually put policies in place to ensure that we protect intersex people in South Africa. Intersex South Africa is also currently busy at the beginning stage of a intersex genital mutilation litigation case. So this Intersex South Africa is doing with the help of Iranti, and we also have Northern and Brooks attorneys that is assisting Intersex South Africa. We are still in the beginning stages of this litigation, where we collect statements from our members, and we're basically drafting the strategy for this litigation. And we're hoping that at the end of the day, someone will listen to intersex people within South Africa. And it's been tough. It's really been tough. Sometimes you think all your conversation, it just falls, and no one is listening to you. But I think if, as intersex people, if we continue and we don't stop this fight, that we will ensure that we do get rights for intersex people within our region as Africa, but then also making small steps in Southern Africa as well. Thank you.
Thank you so much, Crystal. And just a small recap from you there is that the first one that we're doing in South Africa right now is contributing to legal review and reform. The Department of Social Development earlier this year issued a submission on the amendment of the Children's Act. And what they wanted to amend there is to include a banning on genital mutilation in children in South Africa, all genital mutilation in South Africa. Of course, that became a very complicated conversation because it included multiple forms of genital mutilation, and everybody wanted to defend why they thought it's right. And what we did as Intersex South Africa is to have a submission asking that intersex genital mutilation also be considered as a form of children's genital mutilation according to South African law. And we've submitted that, and we'll see what happens next year when the amendments goes before Parliament for discussion. The second one is the litigation that we are all very, very excited about. And it's not only to say we want to ban intersex genital mutilation, but we want to hold doctors accountable. And accountability is what we are asking for, that there should be sanctions for people that continue to do this, and there should be redress for victims of this violation. So we'll see, as Crystal has said, how what happens with the litigation, but we're very excited about. Ronnie, to you, according to you, how's the situation in Zimbabwe looking like? What are you doing to challenge IGM in Zimbabwe?
Okay, basically here in Zimbabwe, unfortunately, the Constitution of Zimbabwe does not recognize intersex people. There is no mention whatsoever of intersex. Therefore, it's we find ourselves at a very difficult position, whereby we, ever since the formation of the intersex community of Zimbabwe, that was towards the end of 2018, we are also at the early stages of the formation of the Zimbabwe intersex movement, whereby we are pushing for the legal recognition of intersex people, because we believe that it has to start there, whereby at least there is some mention, some recognition, some acknowledgement that intersex people do exist. And we also found ourselves in 2019 being part of a national program, which was the access to documentation for Zimbabwean people. So we did our report and appeared before the commission just to sensitize them, so that at least there could be some form of legal recognition through legal documentation, be it birth certificates, IDs, passports, you name it, so that at least we can start there. After that, there was a report that was produced, and I'm proud to say that within the report, there was some form of acknowledgement and recognition of intersex people who were part of the process. And after that, this year, we saw ourselves starting to petition. We did a petition that we are still finalizing to petition through Parliament to end intersex genital mutilation that are happening at all the major hospitals in Zimbabwe. Because, like I said earlier on, it's very unfortunate that these big hospitals, besides the United Nations explicitly mentioning that intersex genital mutilations on babies and children who cannot consent, especially if they are unnecessary, if they are not life-saving, they are a human rights violation. So therefore, we are petitioning before the government for us to at least engage, so that we can be heard, we can present ourselves as evidence, and we can also present all the evidence, and we can give recommendations, even from all the best practices. I think from Malta, if we look at countries that have the best practices, we do have Malta and Australia and some parts of the US, and I think Kenya has been progressive as well, and we are also looking we are also looking at South Africa, which is doing great work in terms of protecting intersex children through the Intersex South Africa. And since we haven't as yet been afforded the platform to engage with the policymakers, because it's very, very difficult. You know, the Zimbabwean context, it's very difficult for us to break that ground, even to find ourselves being in that space. It's not easy, but we are still pushing to try and see that we can have that engagement. One of the biggest part of our work that we are actually doing right now is that we are still at that stage whereby we are sensitizing society, because I think we believe that it is very, very important for us to gain that public support, because we can get policy at the upper level. But if we do not get the public support, sometimes it will also be problematic, because people will not be aware. So we are busy raising awareness within society, and we are also engaging with doctors through social media, through media platforms and different other platforms. So it's still groundwork that we are doing, but we are trying to push and hoping that in the near future, things are going to turn out the way that we are expecting. Thank you so much.
Thank you, Rani. That's a lot of work. That's very, truly powerful work. And Bana, Crystal mentioned a lot of things like working with the Department of Justice, an SAEU conference earlier this year. But at the end of the day, with all those things, is the government, is the state truly listening? Especially since you're taking them to court. Are they really listening?
Yes, Tabi, I think from the work that we've done as a country and as an organization with partners that we partnered with, I think with the processes that has been going on ever since, I think for the past 3 months, having to have an EU engagement, having to have an engagement with the Department of Home Affairs, talking about issues of gender identity documents and stuff, Home Affairs being involved, social development. What would be interesting is to see accountability from the Department of Health in particular, of which I think they're still one of the departments that needs to really get into the ball in making sure that in terms of one of the recommendations that we have actually given to say that, access to truth, which is actually, access to your medical record, is something that, the department can actually provide in making sure that we actually get, justice and truth for intersex people within South Africa. And I think the Department of Health would be one of the departments that will be able to give that. And the redress and actually, making, those particular sanctions, that we recommend for healthcare workers within the health fraternity to be something that is given would be that particular department working in conjunction with the Department of Justice, ensuring that whoever is infringing on the rights of intersex patients and intersex clients is sanctioned, and actually law takes its course in making sure that the rights are protected would be one of the conversations that we need to enforce in the coming year, and actually try to sit in the table with the Department of Health in particular in making sure that they understand the importance of this particular work that we are doing would be one. But as for the work that the work that we are doing, I guess we are in the right direction.
Thank you, Bana, for that. Maybe just a bit of Q&A time there. Any questions that you'd like to pose to the panelists, please just slot them in the Q&A section there. There's a lot of conversation in the Q&A around funding, around money. First question says, why are intersex organizations so underfunded? Second question says, what is the funding landscape for the intersex movement? Then there's another question around, this work needs funding. Why do donors care less? Yeah, and I think I'm going to use that narrative. Why do donors care less? Why are we so underfunded when we are doing so much work with so few people? Yeah, why? Where's the bag? Where's the money?
Yeah,
Who should answer that question?
Crystal. I'll start with Crystal.
Yeah, I think personally, just doing this work in the last few years, and seeing a little growth in the intersex movements, but we're just not reaching that pinnacle, and oftentimes become stagnant because of no funding, right? Funding is such a problem within the intersex community in itself. Countless of applications just gets declined, with no information. It's just, we don't support intersex work. And you find intersex communities, if you look at as Africa as a region, we probably all get a small grant from one donor, and that's it, and that's all we get. Any additional applications that goes through, it just gets declined. This is such important work that we are doing, right? Like, intersex people's human rights are completely stripped away and doesn't get acknowledged at all. But in order to actually come to the party and do this work, we need the funding to do this work, right? We need people on the ground. We need people to be doing this. But intersex people are not funded. If you look at the statistics, like, we receive the least funding within the LGBTQI plus community. I haven't seen this changed in the last few years. I'm not sure if it's going to change, but I mean, in order to do this work and to really change the narrative, not just as a region, but in this world, intersex people needs the funding. Thank you.
Thank you, Crystal. We need the funding. Ronnie, I saw your hand up.
Oh, yes. I was just struggling with my technology. Yeah. Okay. According to a survey, I think it was a research that was done, I think some couple of months ago. It actually showed that, I can't remember which organization did the research. It showed that intersex funding, the global LGBTI funding, intersex funding only gets probably 1% or less. That comes to the global funding for the whole of the world. And when we then divide it and look at how much goes to Africa, it's such a small percentage. So just to agree with Crystal, it's such a tiny amount of money that then ends up getting to the work that we do, because we do have a lot of intersex organizations that are now starting to come up. And in most cases, you would find that many people or many activists, they are not keen to work, to do the work, because there is no money. People need to live, people need to, to have their livelihoods. But if the work, you are only doing the work for on a volunteer basis, it then becomes problematic. So I think one of the other reasons why some of the funders do not fund intersex work, I believe that, I might be wrong, but I believe that maybe they do not have a full understanding of intersex or intersex work. I think there is this misconception that if they fund LGBT or maybe LGBTIQ work, they've automatically covered on specific intersex work, which is not precisely the case all the time. So that then leaves all these gaps, whereby you see that intersex-led organizations, they end up suffering, and sometimes they just die a natural death if activists are not strong enough to keep carrying on with the work. Thank you so much.
Thank you so much. I think the other thing that's happening is that intersex organizations are caught up in a cycle that's never ending. We are too small because we don't have enough funding. So only 1 or 2 people are working, can afford to give them like half their salaries at half, the time. It's a very small organization. And when you apply for funding, then the donors say you don't have enough capacity for a big grant. So we'll give you a small grant. And now you have small grant and a small grant and a small grant, and you get caught up in a cycle of never actually increasing your capacity, because you're always seen as small and not having the right capacity to actually have a bigger grant. And so the bigger grants go to the bigger organizations doing LGBT work that's not necessarily intersex work, that's also not reflective of the lived realities of intersex people, and also not intersex-led to begin with. So we're just all caught up in the cycle, and it seems like there's no way of breaking the cycle. And it's very sad when you are under-resourced, underfunded, tired, sick and tired, and you're sick and tired is also sick and tired, and you're fighting against a huge industry that is well-funded, well-organized, well-oiled, and extremely supported as well. So it's very hard to see a win at the end of the day when you're caught up in the cycle of always begging for cents and not getting the right amount of money that you need. And so I will change the narrative as well. So it's not that we need the money right now, like we really want the money now, like enough talking, just give us the money. Honestly, and don't make us write 50-page proposals for the money. We do not have the capacity to write 50-page proposals. Give us the money. That's it. We'll do the work. We're going to do the work. We've been doing the work. Anyway, going to media engagement, there's a question there around, do you find that the media are willing to engage with you to help raise awareness and educate the public? So how's media engagement been in South Africa and Zimbabwe? We'll start with Crystal and then go to Ronnie.
Hi, Fiona. Good question. I think in South Africa, we've really had good media engagement, like even the video that we showed in the beginning of our session. So there's been really some good engagement. I think in the beginning, I would think 2017, it was very sensationalized. So the articles were not really speaking to the lived realities of intersex people. But I've seen actually now in the last 2 years, the narrative has changed, and intersex people do have an opportunity to tell their stories. And we have a good engagement with media reaching out, wanting to write stories or do documentaries. I think that there could be more because I think like even though we're trying to get this visibility, I don't think that intersex issues are that much visible in South Africa yet, because you still can get someone and they'll ask you what is intersex and what is the issues that intersex people are facing. So I feel like somehow the media is actually not reaching the community that we needed to reach, and so I think there's an opportunity for more engagement, but there is some engagement, and I think it is definitely improving. And the narrative is being held more by intersex people, which I think that's really great.
Thank you, Crystal. And to everyone else, please, if you have any questions for Bana, Crystal, and Ronnie, please just enter your questions into the Q&A section of this call. Ronnie, how's media engagement for you in Zim?
Well, in Zimbabwe, I think I can speak from a perspective of both private and public media. In terms of public media, that is mostly state-owned media, unfortunately, intersex issues are not understood. So Zimbabwe being a country that criminalizes same-sex practices and LGBT people are not given their rights. Unfortunately, when it comes to intersex people, they are caught under the same stigma and discrimination, whereby we are not given the platform to even speak of our issues or to raise an awareness through public media. I remember the other time when I visited a public broadcasting media house, and I was supposed to speak on gender-based violence. So the moment that I started speaking about intersex people being also the recipients of or being affected by gender-based violence, unfortunately, my program was cut short. So that's how sad it is. And when it comes to public media, we have worked with a couple of public media, of which, yes, they are willing to take up our cases, but sometimes you would find that they would be expecting sometimes some form of payment, maybe for us to continue, because as much as when we are raising an awareness on intersex issues, it's not a once-off thing. We just don't do one program and then it is done. We need to continually engage with people so that they fully understand intersex issues because it's quite a broad subject. I think one other area that we have been taking advantage of is social media. I think this is a platform that we have been utilizing to raise an awareness, because it is a platform that doesn't restrict us that much. So therefore, we have found it as a platform that is friendly to us and that is accessible. And unfortunately, sometimes we also need enough resources for us to be able to be visible, like without taking breaks. But in terms of all the different, the 3 different media platforms, that's my contribution. Thank you so much.
Thank you so much, Rennie. And I see we don't have any other questions there. So to my lovely panelists, just to wrap up this conversation, can you give us 2 straight to the point recommendations around IGM? What is it that you want? We'll start with Crystal.
Yeah, I think so. Just from my side, firstly, we need to prohibit medically unnecessary surgeries and procedures on the 6 characteristics of intersex children and protect their physical integrity and respect their autonomy. Also, we need to ensure that human rights violations against intersex people are investigated and the alleged perpetrators prosecuted, and those victims of such violence have access to effective remedy, including redress and compensation. Thank you.
Thanks, Crystal. Bana?
Yes, mine would be sanctions. Sanctions should exist for the healthcare providers who violate the rights of intersex children. And the last one would be redress should be available for intersex people whose rights were violated. So that's for me.
Sanctions and redress. Ronnie, any recommendations on your side?
Oh, yes. I think we need to ensure that antenatal care should include providing parents with evidence-based information on all intersex variations. Secondly, we need to ensure that families and doctors should use all available information to make the best possible decision on a gender of a relieving for intersex for relieving for intersex children to be used until intersex children are able to self-identify.
Thank you, Ronnie. So just to sum it all up, from Crystal, we got the fact that IGM should be banned. No conversation. It's not a question. It's a command. It should be banned, except in instances of medical emergency. But we know the doctors misuse the concept of medical emergency. So medical emergency itself must be clearly defined, and it should include physical health and not instances of social and physical factors, right? And we also got the fact that we need to have clear standards of health drafted and implemented. But it's not just standards of health that are drafted by some doctors somewhere they are away from us. They should be drafted in consultation with the intersex community, in consultation with intersex organizations themselves, and they must measure up to current human rights standards. And then from Bana, we got the fact that, hey, sanction the doctors. The doctors must pay for what they're doing. They must not be let loose to do as they please on intersex bodies. But not only just sanctions, there should be redress for victims of IGM. So there was a clear direction around accountability from Bana there. And from Ronnie, I heard a lot about improving things around intersex healthcare, around ensuring that antenatal care also includes affirming intersex information, and also that families and doctors use all available information and not just information that is pathologizing from the medical fertility, but also all available information, including from the intersex community, in actually coming up with a gender framing. Because we're not saying do not come up with a gender. We're not saying do not assign a gender. We're saying do not medically, surgically assign a gender. That's what we're saying. And also, Ronnie also spoke about, in the spirit of truth, that we should include things, intersex people should have access to their medical records, because that, also affects access to justice and access to redress. If you don't have your medical records, it's really hard to get all of those things. So thank you very much to my lovely panelists. Thank you, Crystal. Thank you, Pana. And thank you, Deborah. Thank you, Ronnie. Thank you, everybody else that's been part of this panel. And we wish you best of luck with the rest of the conference.